Hair loss has been a common concern for both men and women. Over the years, many treatments have come and gone. One treatment, the gold standard for hair thinning and hair loss, is PRP or platelet-rich plasma. Now, even advanced PRP treatments like GFC or the growth factor concentrate are giving better results. And it has been well proven in various research papers and articles that PRP is an effective and safe treatment for male pattern hair loss or androgenetic alopecia. So the question is PRP an alternative to hair transplant? So myself, Dr. Sumit Agrawal, a consultant plastic and hair restoration surgeon with 15 years of practice, having treated patients in India and abroad. Today, I will be discussing the details about the PRP procedure, how is it processed, the benefits of it, and the limitations of the PRP procedure, how it can be an adjunctive to the hair transplant procedure rather than being an alternative to hair transplant. PRP or platelet-rich plasma is made by withdrawing your own blood sample, which is processed or centrifuged to create a plasma extract which is rich in platelets and growth factors. Plasma extract, when injected into the scalp, releases growth factors. These growth factors stimulate the growth of the dormant hair follicles, improve thickness of the existing hair and quality, which helps us in giving a better hair volume. PRP is a popular treatment because it is minimal invasive, no downtime technique. It's just an OPD based procedure. It's your own blood sample, so no chances of allergy. It can always be combined with medical treatments like minoxidil and finasteride to control hair thinning and hair loss, and it can also be used as an adjunctive treatment to as hair transplant to boost the results of transplant and get a better regrowth of the hairs. So PRP is not an alternative to hair transplant. It is best advisable for early grades of hair thinning, pushes the hairs in the dormant phase to a growing or the anagen phase. In general, PRP 3 to 4 sessions are advisable at monthly intervals. The patient can expect improvement in the hair volume and hair texture after 2 to 3 months and can see the peak results in around 6 months, after which the maintenance sessions are advisable every 3 to 4 months. In Harleys Clinic, we combine PRP treatment with other hair restoration treatments like with medical treatment, minoxidil and finasteride to control early grade of hair thinning. In more advanced cases, it can be mixed or combined with other hair restoration treatments like exosomes or mesotherapy or low level laser therapy, which in combination will help in faster rejuvenation or regrowth of the existing hair, and always in combination with hair transplant treatment to help in faster healing of the scalp and regrowth of the transplanted hairs. Usually 3 to 4 sessions of PRP treatment are advisable at monthly interval. You see an improvement in the hair thinning and quality in 2 to 3 months, and peak results are seen in 6 months, after which maintenance sessions are advisable at every 3 to 4 months. Results of PRP vary depending on the technique of the injections and the volume of the PRP. Volume of the PRP or the blood sample collected is an important variable which can affect the results of the PRP procedure. In general, 15 to 20 ml of your blood sample is withdrawn, yield then around 6 to 8 ml of high concentration of platelet-rich plasma. Plasma concentrate is injected in 0.1 to 0.2 ml doses over the entire scalp, spacing at an interval of around 1 centimeter. The platelet concentration should be around at least 3 to 5 times above the baseline platelet value. At Harleys Clinic, we use PRP treatment as a standalone and in combination with other treatments like medical therapy, someone who is taking minoxidil and finasteride. It can also be combined with other hair restoration procedures like low-level laser therapy or exosomes to give a much faster or better regrowth of the existing hair, and always with hair transplant technique in which it helps in faster healing and regrowth of the transplanted hairs. To conclude, PRP or platelet-rich plasma is still the most popular and the most affordable treatment for hair regeneration, and it works best when it is included early in your hair restoration treatment plan. In advanced cases of hair loss, then the only option is advanced Sapphire FUE technique. So if you're struggling with hair loss and wondering whether PRP or hair transplant is a better option for you, then book your consultation at Harleys Clinic, and we will do a folliscopic computer examination and advise you whatever suits you best. Kindly like this video and share it with your friends who are suffering with this hair loss problem, and subscribe to our channel for viewing more such informative videos. Thank you.